a minute, an hour goes by, and you think, well, that's stupid, I'm still okay. So a lot of the time you're on your own, you haven't got people monitoring you, and you've got to be brave. And when you go out and exercise, you stick within the safe limits, you take your pulse, etc. Some days you're a bit more breathy, and you think, well, shall I call the doctor? Shall I call 999? You think, no, leave it a little bit. Don't leave it too long. But you know yourselves now, because you're listening and monitoring yourselves and listening to your own body. You know how your body responds to exercise, and when it's having an off day and it's not, and when it is true cardiac related. So the CEO Identity, with Russ Besley, we had a chat, and Russ, I don't understand Russ's background, but I think he had something to do with graphic design. He said to me, give me your ideas and I'll see if I can turn it into a logo. So I gave him that, and that's what he came back with. So then I had to then get it trademarked, which I did. But all the time I was thinking about these patients who are isolated, the ones that don't attend cardiac rehab, no form of contacting each other or having some good advice. So I then put together a magazine, which we did for a number of years, actually, myself and Russ. Do you want to pass them around? For a number of years. And they proved quite successful, and everybody was interested. And we knew that we had to include certain things about risk factor reduction, lifestyle changes, dietary advice, exercise advice, all the usual things that you see in magazines today. The shelves are full of all this advice now. Then the internet came into being. And I was playing with the idea, before I moved to Portsmouth, I was playing with the idea of a web page, because I had all this information. I was going to change jobs. I was going to no longer be involved in cardiac rehab. And I thought it'd be a waste if that just collects dust. So I'll just stick it up on the internet. I realized I needed to create a website. I then put that up. There was a contact me address on there, and I get an email from some character called Dave Tuttle and many others as well. And they were all talking about, how can we talk to each other directly? And I thought, okay, I need to look at this thing called a forum now. So then I looked at various packages, and I decided I'd go with V-Bulletin. They had a very good package. Recently, I've added this magazine thing. Now, the whole idea of that is that you can then report your own sports events, a bit like a journalist yourself. So if you go on an event in your part of your country, you can then go up there and put your story on there with pictures and act a bit like your own sports promoter and journalist, okay? So that's taking you one level further on. Something we tend not to focus on too well is the mind, okay? When I put this website together, I was trying to deal with the mind more than the body, in actual fact. A bigger organ, and yet we know so little about it. Think about these loops that you get into in a negative spiral. I'm a cardiac cripple, I'm a cardiac athlete. You start out happy, life gives you a few knocks. How do you deal with it? People deal with it in different ways. What does it do? That's where you end up. Not always. I mean, some of us are born. We're not, we've been dealt a bad hand at the beginning. So this tornado effect, I mean, you get into a spiral, and down you go, and you throw off all your hopes and your dreams, etc. I've been there, and I know what that's like. So the mind does affect the heart. Stress does affect the heart. I was getting palpitations and sleep problems. And we now know that the brain can affect the heart in many different ways. Something, just on as a little aside, this Takotsubo's cardiomyopathy, stress can actually affect the heart very, very badly. And on this fluoroscopy image here, it shows the bottom of the heart failing to contract at all because of stress. Now, there's many theories as to why that might be. Why is stress affecting the heart that badly that it's actually failing to contract and form that shape? There's many different theories as to why. And one of the theories is that a lot of these stress hormones are affecting the small blood vessels and causing them to spasm. That's just to show you this mind-body link again. I wanted to turn things on its head. I wanted to turn that vortex, that tornado, which would lead you down into depression, on its head. So I wanted the website to pull in everything, suck it all in, so you actually join the website here with a miserable face, and everything lifts you up. Okay, there might be something on there, just one word, and it would change you around and make you feel positive. And then if the website becomes successful, it becomes more and more powerful, pulling in more and more people the same, and putting more and more good ideas into the website, and it elevates people. But by 2020, there's going to be 75 million Americans of 65 years or older. And are they going to go through cardiac rehab? A lot more people are coming this way, I would imagine. This is just so that I'm saying to you there's a rosy future for cardiac athletes. Heart failures. Although it's slowing, it's an on and upward trend, but it's actually slowing heart failures, and there's a reason for that too. And the deaths attributed to heart failure are flattening off as well. And the number of heart transplants being performed is actually plateaued as well. But there's a reason for that, because we've actually got better at dealing with heart failure. Where we've got primary PCI, I'm sitting in the lab, the phone rings, it's a paramedic, we've got a heart attack patient, can we bring them in? So heart attack patients come straight into the lab now, get ballooned and stented, so that reduces the size of the heart attack area on the heart muscle. So they then don't go on to be heart failure patients. That's what's affecting that previous graph. There's other things like better medication and also cardiac resynchronization, pacemakers. All these things are actually stopping there being more heart transplants needed from heart failure. The pattern with valve replacement, I mean, there's a crossover now towards more natural valves rather than mechanical valves, because it's healthier for the red blood cells. It doesn't mash them to pieces. The revascularization rate's obviously highest in the US, the lowest in the UK. We're using now drug-eluting stents and bare metal stents, and the graph is actually switching so that we're actually tending to use more drug-eluting stents, and there's a good reason for that. When I put this presentation together, I wanted there to be something for everybody. So this is for the people with stents, etc., or heart attacks. Look at this extra thickened area here, look. This is with the drug-eluting, that's without the drug-eluting. That's narrowed that vessel. Even though you've put a stent in, it's become narrow again. So these drugs are there to try and protect you against that and keep your coronaries open. So these are all new technologies. So there should be, what I'm getting to is that there's going to be more people coming through like you who hopefully would like to join cardiac athletes. There's a move towards absorbable stents as well. These things hold the vessel open, deliver their drug, and then dissolve. They've done their treatment. The trend is towards those drug-eluting stents and also bio-stents as well. So this is the future. But this is happening now. And that's the trend, look. So less bare metal, more towards drug-eluting stents. This is happening now. This is making treatments for people like you more efficient and increasing the numbers, hopefully, for my website. Upward trends. Technologies driving that are things like intercoronary ultrasound machines. The picture on the right, I remember seeing in a movie of, I think it was yours actually, some years ago. I mean, it's very similar to The Fantastic Voyage, isn't it? You can actually now see inside the coronary, except it's in black and white. There was also another reason why I think that movie stuck in my mind. Anyway, we use rotablators, which bore through any calcified vessels, which you can't get through with a balloon or a stent. We're measuring pressures within the coronaries. So all these treatments now are more effective, more numbers for cardiac athletes again. We're using balloon pumps, so less heart failure patients. Increasingly sophisticated pacemakers. Now the thing with the pacemakers, for cardiac athletes, you want them to have dual sensors. You want them to not only have an accelerator, an accelerometer, but you also need them to have a minute ventilation sensor as well. And there's certain conditions where an accelerometer wouldn't be beneficial. If you're walking on soft snow at altitude, you are going to be short of breath because that accelerometer is not going to experience enough vibrations to push the pacing rate up. And there's other sporting activities as well, like being in water and swimming or on a bicycle. There might not be enough anteroposterior movement to cause the vibration on the crystal. So a minute ventilation sensor is a good thing for someone who needs a pacemaker. So if you've got one on board, well done. Cardiac resynchronization therapy is another treatment that's come on now, and what that does is it helps to resynchronize the firing and the contractility of the heart walls, so that, okay, just had a message come up on here, unable to connect to the wireless network. But so the cardiac resynchronization and bi-event pacemakers are very good for heart failure patients. And what that does is it tries to resynchronize the heart wall so that it contracts in the fashion that it was designed to. The heart's designed to have a corkscrewing motion and shove the blood out, a bit like a bullet out of a gun, okay? Now the tip of the bullet is very much like the shape of the waveform on the echo, and it actually holds red blood cells. A heart failure patient might have no more than, say, an eggshell's worth of blood when they eject their heart. The normal range is from about 50 to 120, so that bigger cup there of blood would be the low end of normal. So it's important when you're exercising, you're trying to make a more efficient pump, more stroke volume when you're exercising. You're training the heart muscle to contract better. You want more stroke volume. We're promised this Web 2, so there should be more interconnectivity on the web, sharing of videos and cine clips. So there's a lot to look forward to and a lot happening. Smarter drugs, stem cell technologies. The Wellcome Trust has just completely mapped the human genome, so hopefully that's going to lead to more therapies. And again, increasing the number of people coming through with cardiac conditions, maybe cardiac rehab, hopefully more members for the website. We have to think about the future, because that could be the future. A lot more people out there running, and you have to spot the normal person. But the norm is changed now, because in the future there's going to be a lot of people with various things who have gone through various heart conditions and surgeries and have made a full recovery, and they're out there running marathons and doing all kinds of things, and it's going to be the norm.
It sounds kind of funny to say I only had a triple bypass. We were all opened up, but some of them have gone through a lot more and have had difficulties and other side effects that for me didn't exist. And the fact that I could do what I did 7 months after my surgery, I guess I appreciate it more being around some of those other athletes, some of the other people here, and I'm just amazed at the variety of situations and operations. So that's part of what motivates me.
I was in a coma for 48 hours, and I woke up on the 4th of July and wound up having a 5-way blockage, and I had to have a 5-way bypass. And I spent 40 days in the hospital because they couldn't give me blood thinners. When I fell off the treadmill, I hit my brain so hard it bounced. I had bleeding on the brain, and they had to wait for the bleeding to stop before they could give me blood thinners. Otherwise, my brain would bleed out. I was active before, and I would have folks come to the hospital and they say, "Dude, that should be me laying there, not you." Okay, and I had the surgery on August of 2007. I ran the Richmond Marathon, 2008 Richmond Marathon with my cardiologist. And
I had my surgery in June of 2007. Went through a rehab process that I wasn't sure how to go through a rehab process, because rehab processes for cardiac patients aren't the same as for the average day person to me, who was an athlete before. So as I built up my training on my own, basically, to get back to where I wanted to be, 7 months after my open heart surgery, I finished the Miami Marathon.
People have said to me, "Wow, that's great. You're so strong. It's so wonderful that you can get up and do this again." And to me, I would need much more strength to not be able to do it again. To me, the strength is not in going back to what gives me happiness. It would be not being able to go back to what gives me happiness. So I really don't think I'm strong at all. I think that I'm very fortunate.
And I had my surgery then in March of this year, and so I'm now 7 months or 8 months out and planning to do my first marathon back. I've had a lot of marathon experience. I've run 57 marathons to this point, and so this is the first one back of my second running life now as a cardiac athlete.
You define yourself, and many people define themselves by what it is that gives them joy. And if you've been a physically active person your whole life, you know that that is something that gives you joy and gives you something to get excited about every time you wake up in the morning.
I came to Cardiac Athletes and actually found what I'd been looking for about 4 years actually. This is my 1-year anniversary this month.
I've ran my best marathon since having open heart surgery and having my valve replaced. So I think what this group has given me is the inspiration and hope that you can continue on and still reach some great heights in your athletic endeavors.
This site kind of means the world to me because I get so much out of it and I'm able to give something back.
Marathon number 58, number 1 is a cardiac athlete. I've been posting with them for almost a year now. This is the first time I had a chance to be with these guys, and it was great.
It's more of a way to find like-minded people than really to be cardiac athletes, but just people that you already have something in common with.
I was able to converse with people in other countries, in the United States, in England, other parts of Australia, people in similar situations to me who had come back from heart disease and heart problems and surgery, who were doing marathons and cycling and doing triathlons, and they gave me the encouragement and the confidence to start on my road to recovery.
The best way to describe it is you've been through an experience, your family is supportive, they love you unconditionally. Your friends understand and love you unconditionally, but they haven't walked in your shoes. This is like finding long lost relatives, and I think that's what most people will tell you, is that when they connect, it's like, aha, somebody else is out there like me.
Being here in Harrisburg with everyone is such a great experience, being around my own kind and people that understand what I've gone through, and there's a lot of great information available on cardiac athletes, a lot of encouragement from the other folks, and I'm just so glad that I found the website.
As a result of my heart condition and coming onto the cardiac athlete site, in some ways I've actually become a better athlete. I've actually become a better person. I still have my moments of fear and anxiety, and but I'm learning to cope with those sorts of things. And I learned from the other people on this website that they feel the same things too. So sometimes when we share that, it makes us feel a bit better that we know that we're not alone.